Let's talk about cephalosporins. Now, we divide the cephalosporins into first, second, third, and fourth generation. And in general, the first generation are more gram-positive active, and the fourth generation tend to be more gram-negative, and there's a spectrum in between. Now, cefazolin and cephalexin are first-generation agents. They're gram-positive active, and they're very useful in surgical infections because a lot of surgical infections come from Staph aureus and other skin surface agents. There's minimal effectiveness of these drugs against gram-negative bacteria. The second generations, the prototypical agent is cefotetan. They are much more active against gram-negative, and what's interesting is they'll often also work against Haemophilus influenzae, which is one of the major causes of pneumonia in many of our patients. Other agents in this group include cefuroxime. Now, if you notice very carefully, I've underlined two of the agents. I've underlined cefotetan and I underlined cefuroxime. These are the drugs you need to know. Cefuroxime is commonly used in pneumonia treatment. The third generation agents are more gram-negative active. Once again, I've underlined two of them, cefotaxime and ceftriaxone. Cefotaxime is kind of our go-to drug. It's a very good gram-negative agent. It will often work against organisms that are resistant to penicillin. We only use these drugs in serious infections, and in general, they're only available in intravenous form. Let's move on to the fourth generation cephalosporins. So cefepime is your prototypical agent, and notice that I've underlined it because it's a drug that I want you to know. These are more resistant to the beta-lactamases, and they're also active against Enterobacter, Haemophilus, and Neisseria. Ceftaroline has activity in infections caused by methicillin-resistant staphylococci, so we sometimes use it in that case. Now, remember that the cephalosporins are less likely to cause rashes and allergic reactions when compared to the penicillins. Penicillin seems to be associated quite heavily with rash and other allergic activity. Other beta-lactam drugs include aztreonam. Now, this is not commonly used in clinical practice, and you don't hear much about it. It is a drug that you need to know. Why? Because it's resistant to beta-lactamases, which is huge. There is no activity against gram-positive drugs with this particular agent. It binds to penicillin-binding protein type 3, or PBP3. The half-life is prolonged in renal failure, so you can adjust your medication accordingly. Adverse events include GI upset, vertigo, headache, but the nice thing is once again, it's resistant to beta-lactamases, and there's no cross-allergy with the penicillins.